Hello students, now we have to learn about anticoagulant. What is anticoagulant? These are those drugs that inhibit or prevent the action of coagulation factors like heparin or interfere with the synthesis of the coagulation factors like warfarin. What are the classes of anticoagulants? Here I have divided by the route of administration, subdivision of routes according to drugs, means here are the subdivision of routes according to drugs, and here the drugs used for the routes or the subdivision accordingly. The first one is used in vivo route of administration, heparin. Heparin binds and accelerates the activity of plasma antithrombin 3. Heparin antithrombin 3 complex then inhibits activated clotting factors like 10A, 2A, 9A, 11A, 12A and 13A by forming stable complexes with them. At low concentration, heparin selectively inhibits the conversion of prothrombin to thrombin. Heparin thus prevents further thrombus formation. Heparin in high doses has antiplatelet action and thereby prolong the bleeding time. Heparin reduces the blood lipid level by releasing lipoprotein lipase from vessel wall and tissue. The other drugs are fondaparinux and dandaparinol. The next class of drugs are direct thrombin inhibitors like lepirudin, bivalirudin and those. Now, what are those drugs used by oral anticoagulant? The coumarin derivatives drugs like warfarin salt and coumarin derivatives are commonly used. The mechanism of action is clotting factors 2, 7, 9 and 10 are synthesized in liver as inactive proteins. These factors are rich in glutamic acid residues and are carboxylated in liver where vitamin K acts as a cofactor. Vitamin K converted to inactive epoxide from oxidation and regenerated to its active form by epoxide reductase enzyme. Warfarin is a coumarin derivative and has a structure similar to that of vitamin K. Hence, warfarin competitively inhibits the synthesis of vitamin K dependent factors like factor 2, 7, 9 and 10 by inhibiting epoxide reductase enzyme and thus produce anticoagulant effect. Now, the other types of route of administration is used in vitro process. The drugs are heparin, calcium complexing agent like sodium citrate, sodium oxalate and sodium edetate. The mechanism of action of heparin is it prevents the action of thrombin in catalyzing the conversion of fibrinogen into fibrin that occurs generally in stage 3. Besides, it also slows down the conversion of prothrombin to thrombin and stabilizes platelet against clumping and disintegrating. Heparin releases lipoprotein lipase from the vessel wall and tissue which hydrolyze triglycerides of cyclomicrons and very low density lipoproteins to free fatty acids. These then pass into tissue and the plasma looks clear. The side effects of heparins is hemorrhage, means bleeding in the main side effect, and blood in urine and gastrointestinal bleeding are also observed. The contraindication in peptic ulcers, hemophilia and other hemorrhagic disorders are also there. Severe hypertension and in threatened absorption, heparin treatment is contraindicated. According to USP, the dose of heparin should be contain 120 units per milligram. A loading dose of 5000 units of heparin, which may be followed by continuous intravenous infusion up to 40,000 units in 24 hours, are recommended. The therapeutic use is deep vein thrombosis, intravascular coagulation, and in prevention of post-operative thrombosis.